All right. Hello to all the viewers. So basically, this is a session for candidates who are going to attend the NEET SS 2023 exam. So we are doing this video on the 4th of June. So we have just over 3 months left for the NEET SS exam. And it is quite understandable that many candidates will be having doubts, anxiety, apprehensions on what should they be doing in the remaining 3 months. Because as we all know, medicine is a very vast subject. And when you write an exam like a NEET SS, you've got to cover a lot of topics in a short span of time. So this is just to help those candidates preparing for the NEET SS exam. Right. Basically, the intent is to give an idea on the preparation strategies for the remaining 3 months, a few tips, and also to answer some frequently asked questions by the candidates. So when I thought of doing such a session, I thought that definitely we should have suggestions and guidance from someone who has done well in the previous NEET SS exam. And there is no better person that you can get than rank 1 in the previous NEET SS 2022 exam. One of our students at DocTutorials, currently pursuing DM endocrinology at KEM Mumbai. So Dr. Anuj Ban, welcome to this session.
Thank you. Thank you so much, sir. Thank you for giving me this opportunity. I'm looking forward to this session.
Yeah, so I think, this session should be very useful for the candidates preparing for the NEET SS. So Anuj, I'll just share my screen now. Is it visible? Just let me know.
Yes, sir.
Right. Just 1 second. Yeah. Okay. All right. So those who are having any queries can please comment in the chat box as well. We'll be taking your queries also. So as I proceed through the session, you can type in your queries in the chat box. Now, as I've already told you, the tentative date for the NEET SS has been announced. It is at September 9 and 10. So there are multiple groups and you will have medical group exam in one of these dates. The exact date of the exam for medical group has not yet been announced. We are awaiting the prospectus. So as I told you a while back, the aim of the session, number 1, to address certain frequently asked questions of exam appearing candidates. Second, to just run through some of the high yield topics for NEET SS, which is based on the NEET SS 2022 exam paper. And the last one, some preparation tips for NEET SS as well. Okay, so let's move forward. And meanwhile, let me tell you that if you have got any queries for preparation towards NEET SS, you can feel free to contact me. So I've given my WhatsApp and Telegram number. So this is my WhatsApp and Telegram number. And I've got an Instagram academic page. You can follow me in Instagram as well. So I'll be just sharing the logo. Yeah, so you can scan the QR code and join the Instagram page for those academic updates as well. Right. Now, Dr. Anuj, I think we'll start the session with the frequently asked questions by the exam appearing candidates. So let's take the first question. How is the general pattern of questions for NEET SS? Is it similar to NEET PG? So I'll just tell you my views first, and then Anuj also will be pitching in. Now, first of all, I want to tell you that overall, the pattern of NEET SS is similar to NEET PG. I'm just telling overall. That means that number 1, you can have factual questions, you can have clinical scenario questions, and also image-based questions. that happens in the NEET PG as well. Okay, so this will always be there. Now, if you ask me, majority of questions are inclined towards clinical or is it factual? My answer will be, seeing the question papers over last several years, there is always an element of unpredictability. I have seen NEET SS papers being very clinical. I have seen NEET SS papers being a mix of factual and clinical. So I want to tell you, never rely on the just previous year question pattern alone. Okay, so just go through the last 3 years minimum of your previous year questions so that you get an overall idea. Ideally 5 years, but minimum 3 years previous year questions, just go through them. So you get a basic idea regarding that. So second point is that the level of toughness. The level of toughness definitely, as expected, will be a notch higher than the NEET PG. And you will have to have an extensive reading, and the type of reading that you had for NEET PG may not suffice. But having said that, let me remind you that a good number of questions for the NEET SS are at a NEET PG level also. So just because you're appearing for NEET SS doesn't mean that a topic like JVP can be neglected. Even last exam had 2 questions from JVP. Doesn't mean you can neglect the topic of pulse. So even they do ask basic questions as well. So my overall answer to that question is, the overall pattern is the same. The difficulty level is a notch higher, and there is always an element of unpredictability. So I would say prepare for the whole range of questions. That is factual, image-based, and clinical scenario. Dr. Anuj, what do you think? Having secured the topmost rank in the last NEET SS, how will you assess the pattern, not just based on the previous year question, just one paper, but overall, how will you judge the pattern of NEET SS?
I would also consider it very similar to NEET PG, sir. Basically, depending on the difficulty of the questions, I would say majority of them fall in the easy category, but those are the important ones, I would say. For example, in the last paper, we had 150 questions. So I would say 110 to 120 would be considered very easy for majority of the people. And the rest of the questions would fall in the difficult category. But this is what was seen in the NEET PG paper as well. Also, I think those easy questions are the ones we should be focused on more rather than the difficult ones, because getting those basic questions right is where you gain ranks quickly. Getting the targeting the difficult ones would be a bit tricky in the end stage when you are considering only the last 3 months as your preparation time. So I would say just stick to the basics and don't neglect the easy questions, easy topics, and the preparation strategy is remain similar to that of the NEET PG. Also, as you said, it's very unpredictable. We cannot just say that it would be the last year's paper, I would say, was more on the factual side and not on the clinical side. Although had some image-based questions and clinical questions, but majority were factual. But I would really not stick to that and just read factual point, because the pattern really varies year to year. So try to cover all bases and just try to get the easy ones right at this point of the time.
Now, this is a very important point, because Dr. Anuj, I have seen many candidates neglecting the basics. Even if you see the DocTutorials videos as well, majority of the videos for the NEET SS are NEET PG level. Okay, but then we build on to the concepts, and then you have got the test and discussion videos, QRP videos, where we take the level to a higher plane. But I always want to tell all the candidates, please don't neglect the basic topics and basic questions. Like Wilson's disease, it is important for NEET PG, so is it important for NEET SS. So movement disorders, Parkinson's disease, you get questions. You get a question on chorea. They might ask you the site of lesion in chorea. It's an expected question for NEET PG, but they might ask for NEET SS as well. Right. Now, Anuj, having discussed the overall question pattern, were there any surprises in the exam pattern for NEET SS 2022 when you wrote the exam?
Yeah, we had a few ones. Actually, our exam happened on the 2nd of September, I remember, which was the second day. First day, there was a DM respiratory medicine group paper. So I had a friend who had attempted that paper, and when he came from the exam, he was like, the whole paper was clinical based, and they had all MCQs filling half the page of the screen, and all were clinical based. The next step in the management, and so we were thinking that our paper would also turn out to be the same, but it was completely the opposite. We had factual questions majority. Also, there were some topics which we had not prepared as well, like genetics and statistics. There was a few questions from there as well, like mode of inheritance and some syndromes which are seen in childhood, microdeletion syndromes. So these questions really sprung up as a surprise in the paper, which we're really not expecting, and they would be considered as a NEET PG question more than a NEET SS question.
Yeah. So basically, Anuj, for covering those topics as well, what we have decided this time is that in the elite exams, we are adding a separate test and discussion on genetics. So which will be done by someone who has completed DM genetics. So there will be a separate test and discussion on that. And also there is a biostatistics video already uploaded in the app. Anuj, you must be knowing that Dr. Rajasi Madam, the PSM faculty of DocTutorials, even last year as well, she had done that session and it is there in the app. I would request everyone to go through the biostatistics because every year they do ask some or the other questions. Yes, there have been certain NEET SS exam where they have not asked a single question, but I have also seen exams where they have asked 4 to 5 questions. So in case 4 to 5 questions come, they are rank deciding questions. Even if you see for the current INISS, Dr. Anuj, for the gastro paper, especially, the medicine paper had a few biostatistics, but for the gastro paper, even in the gastro questions, they had asked some biostatistics based questions. So, that is the importance of biostatistics. So everyone, please go through that video. That video is exclusively made for candidates appearing for NEET SS and INISS. Dr. Rajasi Madam's video on biostatistics, please go through that. So it's a very important point. So those two were the surprises. So genetics, as I told you, we are doing a session this time. Right. Now, coming to the next question, many candidates watching this interview also, they might have either just completed their MD or DNB medicine exam, or maybe I know that some of them, the exam is ongoing as we talk today. So they recently gave the MD DNB medicine exam. What is the best strategy in the next 3 months? So I'll tell you my suggestions for this. Now, you have got only 3 months left. I know that many candidates might feel, see, what is it about 3 months? I cannot prepare too much. Should I try for the next time? See, you should understand that anyway, you have prepared for your theory exams, which means you have covered a lot of topics. Yes, you might be lacking in MCQ practice. So for you, I would advise that please work out questions. So you have to work more questions from the Qbank. So in DocTutorials Qbank, you have the Qbank exclusively revised based on 21st edition of Harrison, and not just DocTutorials. Suppose you are following another platform also, do the question bank. This is very, very important because you need some MCQ practice. So do the question bank. And then please attempt the grand test. So sometimes when you do Qbank alone, immediately after reading a topic, you might feel that, okay, I know well, but I think you have got to go to the grand test. And grand test, I feel, is the real test of your knowledge. And more grand test you give, that is always nice. And for all these candidates, I would say that even before you start your preparation right now, first give a grand test. Now, this will give you an assessment of where you stand. Because see, you have done your reading for your theory exams. There is a good chance that it might actually reflect onto your MCQ performance as well. You might see that, yes, I'm doing well for the MCQ exams. I'm able to remember and I'm able to reproduce as well. So write a grand test first to begin with. That's what I want to tell you. Okay. Now, if you ask me, so what about the videos? You said about Qbank and grand test. What about the videos? Well, if you have got time and suppose you're not working, you're giving time exclusive for studies, then yes, you might get time to go through the main videos. But as far as for students preparing from DocTutorials, I want to tell you, if you feel that there is a genuine, say, shortage of time, in that case, at least go through these videos which I'm telling you. Number one is the quick revision videos, that is the QRP, quick revision program. So you've got some revision videos in the app. So they are short, concise, crisp videos which you can cover. Each segment has been discussed by the corresponding super specialty faculty. So please go through the QRP videos, very, very important. So that instead of covering a lot of ground with the main videos, you can stick to the QRP videos if you have shortage of time. Number two, I know that you people want to go through Harrison. So this time, Anuj, something that was not there last time, we have added some videos exclusively based on the Harrison tables. So for each specialty like nephrology, neurology, cardiology, we have actually done the tables alone, nothing else, tables and flowcharts alone. So Harrison tables and flowcharts, those videos, if you go through, it will give you a good idea, and you know that many a times you can get questions from the tables and flowcharts. So please go through those videos. You should not miss out on them. Next is the allied test and discussion videos. So every year that we actually have done the allied exams, Anuj also has taken it last year. So wherein each faculty will be putting the question, and for that particular exam with a timetable, and then there will be a discussion following that. I know many of you, because you were doing residency, might have missed out on the exam when it was actually live, but do not worry, it is there in the app itself. Go back and do the questions and also do the discussion videos, because it will help you quickly, go to that MCQ mode and the approach, because we are discussing the MCQs. Because many a times you will see the faculty teaching, but you will have problems when you solve MCQs. For that, these allied test and discussion videos will be helpful. So this is the third season of the allied test and discussion which is going on. If you have got time, I would request you to go through the previous year videos as well, the test and discussion videos, which is also there in the app. The advantage is you get exposure to more questions, because every year we keep changing the questions. So you get exposure to more questions and the discussion videos. So this is what I want to tell you. In case you are short on time, you please go through at least the QRP videos, Harrison tables and flowchart videos, and the allied test and discussion. And not to forget, please write grand test as well. So Anuj, your inputs on this, especially to candidates who have recently passed out.
Majority of the candidates would have read Harrison's to prepare for the exit exam of MD. So I would like for them to stick to Harrison's for now. Just build up on Harrison's only. Now covering Harrison's from cover to cover would be very difficult in this short span of time. So as you said, sir, using some videos like you had said, Harrison-based videos, or some PPTs or any notes you have made before, you can use them to guide your reading to cover the high-yield topics, the tables and flowcharts. These students would not be exposed to MCQs as they have been doing the residency. So I would like for them to continuously solve MCQs as they go. But one point I would like to point out is that when you finish a system, for example, you should not solve MCQs just simultaneously with them, because it will give you a false sense of retention. What I used to do was I would complete one section, then I would solve MCQs for the previous section that I had finished. So I would get a sense of what I have been retaining properly and what I'm forgetting, and focus on that things next time. And going cover to cover at this point of time, covering everything once would be detrimental, rather than going through high-yield topics twice. Also, like you said, sir, grand tests play an important part right now, because you need to get the feel of the exam pattern and not to make silly mistakes in the end. So try to give grand tests as early as possible and give them regularly, so that in the end you try to get into the rhythm of the exam at the end and avoid making silly mistakes in the end. That would lose many ranks at the end. And you would feel very bad when you knew the answer and you would mark the wrong one and come just because you are not in the practice of giving MCQs at a time.
I think very important suggestions, and this might actually help candidates who are running short of time. because I know many candidates after your exit exam, you will be joining the senior residency also in the same department. So you may not get so much of time for preparation. So you adjust your preparation according to the strategy that we have just discussed. And a point that, you just started off discussing, Dr. Anuj. Anuj, I'll ask you this question because see, if I was preparing for MD exam, yes, Harrison is one book I would have definitely read. Okay. Now, there is a question here, like, should I go for super specialty books? Or should I stick to Harrison alone at this point? So what do you think? Because if you ask me, are there questions asked from the super specialty textbooks? Yes, sometimes they do come. But what is your take on this question?
At this point of time, sir, I would like for everyone to stick to Harrison's alone. One scenario I would like to point out is if you have given this recent INI and you have targeted one subject and you are planning to, you have read it in depth for that. So you can go ahead and read that subject at least from in depth from the super specialty books or any videos or super specialty content you have been seeing lately. So for the rest of the topics, I would suggest stick to Harrison for now and not going to super specialty. But seeing the trend right now, everyone would be giving INIs, and which has recently occurred. So I would like for them to concentrate on that from the specialty point of view only, so that you can gain some rank at least in those subjects. I would not say many questions were asked from super specialty books. Majority of the questions you could cover from Harrison's, and only couple of questions from each section, I guess, would have been asked from super specialty books. So seeking to Harrison's at this point, seeing the time crunch would be the best way to go.
Yeah. So I also agree with that. It's important to prioritize. So yes, there are a few questions asked from super specialty textbooks. And suppose if, say, you were preparing for nephrology and you have done with, say, Fihali or Brenner, you have gone through some important tables. So revising those tables which you have already gone through may be a good idea. But suppose you have not touched those books, this is not probably the time to start reading any super specialty textbook. And as Dr. Anuj is telling, since majority of the questions are centered around Harrison, it may not be the exact lines from Harrison, it may be as well, because even in NEET SS, you can see a few questions handpicked from Harrison, modified questions, but I think, the base can be Harrison here, right? So this one, Anuj, how much time should I devote for solving MCQ? So I'll ask you this, that on a day, suppose you were given 24 hours to study a day, okay? So it's a full day. So approximately what percentage of time you would solve MCQs? So if you were in this stage, and suppose, you've got a full day, what percentage of the time of a day you will be solving MCQs and what percentage of the time you will be reading theory?
I would say, sir, 30 to 40% of the time I would be solving MCQs. For example, I did not divide a day as such, but what my pattern used to be was for the first 5 days of the week, I would be studying the textbook, and then Saturdays, Sundays, I would keep reserved for solving majority of the MCQs and going through the related text. So 30%, I would say, sir.
Basically, this question was not a pre-planned question, but, he's actually answering the same point which I was also about to say. Because usually you say that 30 to 40% of the time you practice MCQs, depending on, what is your strength and weakness. Suppose you're not so good in solving MCQs, you make it 40%. Suppose you're good, maybe you make it 30%. So this balance is what is usually followed by toppers and also candidates who have done well. So I think it should be the questions for solving the questions, you give 30 to 40% of your time for solving questions. And I think this is important, Anuj, because I've seen candidates keeping on reading and reading. They do not practice MCQs. They just keep on reading and reading. But I think solving MCQs in a way is a type of revision as well, or shall I put it, a reinforcement as well. And it gives you an idea that, okay, I'm doing well, or say I'm not doing well. I can make some corrections. So I think it's important to do those MCQs as well. Right. Now, this question, where to practice image-based questions from, because this is one message I constantly keep getting. So in the DocTutorials app, you've got certain image-based grand test as well. So you please go through the app and you will find these exams there. So go through these image-based grant test and that will help you. And also in the elite exams that we have conducted in the app, there also we have got a good number of image-based questions. So you can practice image-based questions from that. Okay. Now, regarding this question, can I skip video lectures and stick to Qbank alone? Like, for example, I have decided to prepare for NEET SS. I'm not going to do any video lectures. Can I stick to Qbank alone? What I think is, see, if you are a candidate who has done MD very well, including the clinical part and the theoretical part, sometimes, sticking to Qbank alone might be enough. And suppose you have a doubt in a few topics, yes, you can back refer to the video. So I feel the answer to this question depends on your current preparation. So if you have done Harrison very thoroughly, and then you feel that, okay, now what I need is MCQ practice, I think you can very well stick to the Qbank. But if you're someone who has not read Harrison very well, and then I think, you can watch that Harrison tables and flowchart discussion videos, and maybe the elite test and discussion videos. So all depends on your current preparation level. So you agree with that, Anuj?
Yes, sir. It's totally personal, sir. It's a personal choice. What works for you is you should go for. For example, if you retain more by seeing video lectures, you should go for that. If you don't, if you think that it will take too much time and then you'll have to again go through the text even after seeing the lecture, then I think it's better sticking to the text and the Qbank. But if you're starting out right now, it is, I think, for example, if you're targeting the NEET in the coming 3 months, and if you go through each and every video lecture right now, and then I don't think you'll have time to come back and revise them as well as to go through the MCQs and GTs and all. So for now, I think you can see some of the video lectures which you think are difficult to understand from the text, and rest of the time you can stick to the Qbank.
Right. Now, this we have almost answered this before. How important are giving grant test, Anuj?
It's really important at this time because majority of the people have not been giving grant tests in the last 3 years. We are just doing our residency and working. We are not even used to solving MCQs. And giving 150 MCQs in a go, in a seated environment, in a silent environment, and just focusing during that 1.5 to 2 hours period is very vital, sir. So that in the end, you get the feel of that exam and you don't make mistakes in a hurry in the end. And also, you should be able to gauge your weaker areas if you give them regularly and see, for example, if you start giving grant tests from the beginning, you first of all will come to know what areas you're weaker on, focus on them more rather than giving more time to the stronger areas. And then as you cover the syllabus and check your knowledge giving grant tests, you can look back and see in retrospect what areas, even though you are covered, you are weak in, and you can go back through that thing and skip the parts you have been retaining them. So giving them regularly and making a habit of giving that 150 set of questions is, I think, very important.
Anuj, I know that it has been some months, that you have given the exam, but do you remember like approximately how many questions you would get right out of these 150 towards the end? Do you remember?
I think, sir, I would generally get 120 to 125 by the end.
Is it correct, or you got these many correct responses?
Out of 150, I would get around 125 of them right.
Correct. Got it. So just to give the an idea. Depends on the exam toughness, obviously. But just to have a, do you remember like last NEET SS how much you got?
I think I got, sir, 136 right.
136. So you gave your best grant test in the actual NEET SS exam.
I've never scored above, I think 130, 131 would be my highest in the grant test. So that was the best score that I have got.
Right. Okay, good. So this one, I am not from general medicine background. Is it possible for me to crack NEET SS? So I'll answer this first by telling you that people have done it before. That is the first statement I want to make. People have done it before. Is it easy? Not at all. Obviously, any candidate from a general medicine background is at a definite advantage over the other candidates. But if you are able to put in more time, watch the video lectures, because once you watch the video lectures, you get an idea, okay, this is how a patient presents, because majority of the lectures are like, clinical based, wherein we bring in scenarios as well, so that you get a idea on how a patient presents and how the patient is worked up. Yes, you will have to imagine a few things, because say you have not managed a case of stroke before. So your knowledge will be entirely dependent on what you are watching from the faculty alone. So your reflexes may not be that great because you are not seeing these scenarios, but still I have seen candidates making it, and that goes to show that they have put in so much of effort. And I still remember talking to a few candidates from pediatrics background who have done well. So one point they always told me is that about repeated revision. They have done multiple revisions, and also they gave multiple grand tests. So this is what I want to share with you. So I feel it is possible, but it requires some effort from your side, and also the time that you devote to studies. Because I've seen candidates from non-medicine background preparing for NEET SS, but they spend 2 or 3 hours a day only. So that might not work out. I think you need to put in more time. Anuj, any other points that you want to add on to this question?
Would be difficult for me to add on anything to this, sir, but I guess it's not set in stone that if you are not coming from a medicine background, you cannot crack it. The majority of the questions you can get right, even if you are from a pediatrics background, I guess, and anything from the clinical background and clinical subspecialty. So the only thing that I would point out is that the medicine people would be at an advantage because they would have studied Harrison's right from the get-go, right from the first, second year, I would say. So, but to cover that, you need to put in more time than them. But okay, it's definitely possible.
Okay, right. Now, just want to tell all of you students which latest edition in the video section. Everyone should watch this. The Harrison 21st base tables and flowcharts. I think preparing for NEET SS, this is an easy way to cover the Harrison, because the majority of the high yield points in Harrison come mainly in the tables and flowcharts. So I think, please go through the videos of the Harrison tables and discussion. Now, Dr. Anuj, we are moving on to the high yield topics for NEET SS. We'll just run through these topics, and I just ask you some suggestions as well on this. So this is entirely based on last year 2022 NEET SS question paper. I'm just taking you through those question areas. Overall analysis of the paper, I should say that it was at a moderate difficulty level, and more factual questions than expected. And there were more than expected questions on genetics. And you need to be see, sometimes the paper is very clinical, which can favor that, okay, you even if you have not read Harrison, the lines of Harrison, then okay, you can still adjust with that because they are scenarios. But here it required both your factual knowledge and also the, the clinical reasoning ability as well. So I think it favored the readers also more than the thinkers. Thinkers means, they just come out just with their memory of scenarios, they answer. But here it was a mix. So Anuj has done well in the NEET SS, means he is good with scenarios and also he has read well. So otherwise he will not be able to get the factual questions also right. So I stress on to the point again, please prepare in such a way that you are ready for whatever pattern it may be. Next year, you might see a very clinical paper or even more factual paper. So get ready for everything. And as Dr. Anuj was telling, in the grand test, he had that consistency. So that also will actually help you. Now, coming to the neurology questions, let me just take you through the neurology questions. There were 2 questions on trigeminal neuralgia, a question on cluster headache, ataxia with vitamin E deficiency, wernicke encephalopathy, mollaret meningitis, a question on progressive multifocal leukoencephalopathy, a question based on contraindications of thrombolysis, site of AVM bleed, a question on mesial temporal lobe epilepsy, GLUT1 deficiency. I still remember in my lectures and also the QRP videos, I have stressed on this point. Valproate hepatotoxicity, 2 questions from motor neuron disease, a question from myelopathy with optic neuritis, question on botulism, myotonic dystrophy, side effect of statins on tendon rupture, delirium tremens, trinucleotide repeat expansion disorders, Apert syndrome, and biotinidase deficiency. So overall neurology, if you see, there are some questions which are expected, like trigeminal neuralgia, cluster headache. So as Dr. Anuj said, there are good number of questions asked from the expected topic. But again, you can see certain outliers, questions which were not very expected, like your Apert syndrome, biotinidase deficiency. But you must be ready for a few surprises. However hard you prepare, you will have a few questions here and there which might surprise you. But see, certain questions like GLUT1 deficiency, it's not a very tough question. It is there in Harrison itself. So, that is what I tell you. It's about getting the easy and medium range questions right, and also the few tougher questions. Even if you do not answer a very tough question, it is okay. But I feel, it's about getting those questions like GLUT1 correct, which makes the difference rather than, getting a very rare syndrome right. Anuj, your take on the neurology questions?
I would say, sir, majority of them from the mainstream topics only. So you can see the topics of Harrison, and headache, you can see stroke, and then you can see myelopathy, motor neuron diseases, myotonic dystrophy. These are all from Harrison's only. So these outliers, I would, you were right in that, sir, that you should not you should not go behind getting those questions right. Just stick to getting the easy ones right. And even if you see the question in itself very easy, when you read the question, the topics in itself would seem difficult to look at right now. But when you read the question, you would realize that the question, and seeing the options, you would say the question was easy and very doable.
And also for the viewers, if you want to have a detailed version of this, it is available in YouTube itself. You can just search, say for neurology, I've done the recall so you can type my name and the NEET SS recall. It's available freely in YouTube itself. And also the other subjects, we have done recall for all the subjects. So please go through the recall videos. Coming to cardiology, yes, there were ECG questions, one on RBBB plus LHB, an ECG of a 2:1 AV block, cardioprotective effect of empagliflozin. How many times you would have heard that during your residency as well? I'm sure, during the journal clubs, you would have been repeatedly asked this as well. And you had some basic question on heart sounds, paradoxical S2, 2 questions on JVP, one on TR and one on TS. Now, this is what I said. Don't neglect the basic topics like heart sounds, JVP, thinking that, okay, I just write it from my memory. Suppose you're very thorough with it, okay, fine. But otherwise, please brush through these topics. And then question based on Laplace law. Then a question on antiarrhythmic, management of inferior wall MI. They asked a question on valvular heart disease, aortic regurgitation, heparin-induced thrombocytopenia. A question was asked. Then sine wave pattern in the ECG on hyperkalemia. Then RBBB can sometimes be physiological, that but LBBB is always pathological. So you had a question based on that. J-point elevation hypothermia, it's a question you expect for NEET PG as well. Carpentier classification, I have discussed this with MR in the DocTutorials videos as well. Even in the NEET medical group section, I have discussed this. But this is a question which is there in Braunwald. Okay, this is not there in Harrison. So this question is there from Braunwald. But again, even if you do not get it right, it's okay. But please don't come back after getting these questions wrong, like from heart sounds and JVP. Question on Fedget sign, again, NEET PG level question, not an infectious cause of heart block. ECG question on electrolyte disturbances. So overall, if you see, majority of the questions from expected topics, okay, with, 1 or 2 outliers, that's it. Anuj?
Majority you can solve either from clinical scenarios or NEET PG level questions. Yeah. So not even, no difficult questions at all except the Carpentier classification. You can solve based on your residency and from the NEET PG level knowledge. Yeah. Cardiology was a easy one.
Hematology, prognostic markers of AML. Again, you have learned for NEET PG, the AML with best prognosis, CLL dry stage, a question on acquired von Willebrand disease, drugs used in Hodgkin's disease, post bone marrow transplant infections, RSL, Dewey score, drug with the definite risk of hemolysis in G6PD deficiency, methemoglobinemia, 2 questions were asked, iron deficiency anemia, side effect of darbepoetin. So again, many questions from expected topic areas, but again, certain outliers. But sometimes, you get these right. For example, Dewey score in the QRP section, if you see, Dr. Shinto sir, the hematologist, he has already discussed this. But again, it's an outlier. Even if you get it wrong, it's okay. Okay, but sometimes you get a bit lucky, because I've seen when I interviewed candidates last time, someone who has gone through the NEET SS QRP was able to answer this. So for these sort of questions, just go with the QRPs, because when I take a QRP, I'll be discussing points which I anticipate. So similarly, the hematologist might anticipate certain questions. So I would say that you never miss the QRP, even if you miss the main videos, right? So Anuj, hematology, how is it?
Yeah, sir. Totally based on Harrison, sir, except that you have a question. You can get everything else, almost everything else right, just if you read Harrison's and retain those points.
Coming to rheumatology, I think it was very simple, and a couple of questions from immunology as well. Causes of positive ANA, treatment of rheumatoid arthritis, reactive arthritis, fibromyalgia, giant cell arthritis, cryoglobulinemia and association with HCV. Now you read all these questions, it is almost like a NEET PG level, right? If I say that these questions can be asked in NEET PG, you agree with me. The only thing is that they asked a question on pigmented villonodular synovitis. This was a question which is there in the grand test which we conducted as well. But overall, if you see, majority questions expected NEET PG level question, and SCID most common inheritance, and also the ligand for toll-like receptors as well. Anuj?
So NEET PG based questions were there, sir. This ligand for toll-like receptor, SCID most common inheritance, this we would be solving in NEET PG.
Yeah.
Also, the rest of the questions were straight from Harrison's, like ANA, RA, reactive arthritis, fibromyalgia, everything you could get from Harrison's.
Now coming to gastroenterology and hepatology, staging of cirrhosis, management of severe alcoholic hepatitis, then the AIH, autoimmune hepatitis simplified score, a scenario on HBV patient on rituximab, duration of antiviral prophylaxis. So Budd-Chiari syndrome, there were 2 questions based on it. A question on liver enzymes, question based on accelerated hepatitis B immunization schedule. HCC, the treatment based on Milan criteria, not an association of HCV, was asked. Asymptomatic HCV management, the Lilly model, cell responsible for liver cirrhosis, diet and pancreatic insufficiency, motlin receptor agonist. There was a question based on ERCP as well, an image. Total parental nutrition, they asked a true statement, Crohn's disease, and also ileal resection. So here I felt, there were a few questions from the corresponding super specialty textbook from the gastrohepato. But again, I would say that yes, there were questions based on Harrison as well. But if you compare with other specialties, a few more questions from the super specialty textbook as well. Anuj?
Yes, sir, definitely. I would say I had gotten most of the questions wrong from gastro section only. Yeah. I could see many questions not from
as well. A few questions from Sri Singer they had picked from that as well. So,
but you would expect some questions to be asked from super specialty. So we cannot do anything, but we cannot go through every super specialty textbook, but try to get as many questions from Harrison's, right, and try to build on that so that you can answer some of them outside Harrison's also. But directly coming from super specialty questions from super specialty line to line, you cannot definitely not answer that. So, but don't stress regarding that. Just try to focus on the basics and try to get the easy ones right.
And also, like I would suggest everyone to go through the previous year questions as well. It's not that every year they repeat previous year questions, but sometimes suppose, from this question, they repeat 4 questions. Just assume that they have asked 4 questions from this. I'm sure that many candidates would get it right. Okay. So you cannot have a scenario where you miss out and others get it right. So at least the recent previous year questions, please go through it. Okay. Endocrinology, drugs preventing onset of type 2 diabetes mellitus, neurofibromatosis type 1 with hyperparathyroidism, MEN1 central diabetes insipidus, a question on partial nephrogenic diabetes insipidus, which came as a clinical scenario, Prader-Willi syndrome, duration of insulin action hyperkalemia, question on Laron syndrome, menopausal hormone therapy, then a question on non-proliferative diabetic retinopathy, then achondroplasia, the type of mutation was asked, the oral GLP-1 analog question was there, primary hyperaldosteronism, a question on Hurler syndrome, and also daily water requirement per kilocalorie of energy used. So again, a few surprises, but again, many questions were solvable. Okay, so endocrinology also, it was pretty much within your reach except for 1 or 2 questions. That's it. Dr. Anuj.
I would think that endocrinology was a bit of a twister for me because it was actually an advantage for me because I had prepared for INI from the endocrine point of view. But you could see that there were no direct questions like from thyroid or adrenal, like Cushing's, Addison's. You have one question from type 2 diabetes, but you could see majority of the questions were from some lesser studied topics like achondroplasia, and then this mucopolysaccharidosis, and then you Laren syndrome, partial effusion. These, I think, those were some questions which I had get advantage by reading the SS book. So I think one subject you should be reading in depth. For example, if someone had prepared gastroenterology for INI, they would get the gastro questions right. So I would really ask the candidates who have gone through INI to just go through the super specialty textbook again, so that at least they can do their subject very good and in thoroughly in the NEET SS.
So I think, it depends on a bit of luck as well. Suppose there can be a scenario you have prepared very well for cardiology and suddenly you get so many difficult questions for the NEET SS aspirant. But since you have gone through, say, the video lectures at an INI level or maybe the Braunwald, then you are at an advantage. So let's hope that you get that advantage as well. Coming to nephrology, again, I think, very simple questions. KDIGO, aka staging. The Bartter syndrome, type 5, Little syndrome, HIV patient collapsing, variant FSGS, characteristic of dialysable toxin. I still remember Dr. Vivek has discussed in his lectures as well this point, and even one of his exams that he had conducted, he had repeatedly pointed out this in the LI test and discussion of doc as well. So pre-renal acidemia, question on that, Fabry's disease, ADPKD, marble brain disease, post-infectious glomerulonephritis, ABG, acute respiratory alkalosis, malakoplakia, minimal change disease, nephrotic syndrome management, urinary anion gap formula. A few factual questions here and there, but many answerable. Okay, so, you can see that the questions which are rank deciding, for example, the first one is a question, even in 21st edition Harrison, they have given now as a separate table as well, which was not there in the previous edition. But this is something you should get it right. This is not a very difficult question because it comes under the basic definition of AKI. So this, if you read well, you will get it. Okay. So that is what I want to tell you. Even when you go for the slightly tougher question, go from, when you prepare, go from the areas which have more probability of being asked. Okay. Anuj, taking us through the nephrology questions.
I would say it was a moderate difficulty. Easier questions like KDIGO, AK, you should definitely get them right, because getting those wrong would definitely cost you more than getting something like Fabry's or marble brain disease wrong. So just stick to the basic questions and try to get them right.
Anuj, what I've seen is, just again bringing the topic of unpredictability. If I go through the previous year NEET SS, I could not find many topic repeats. What do you think about this?
Sorry, sir.
When I went through the last, NEET SS papers, when you compare 2022 with 2021 and 2020, I could not get many topic repeats.
Yeah.
Okay.
Yes,
so it just shows that the paper is very unpredictable and you have got to prepare accordingly.
Yes, sir. You definitely have to go through the previous questions. There's no doubt in that. But just don't expect that the questions are going to repeat and come from the same topic again and again. You definitely have to cover everything. And but just to practice and just to see what was the pattern going on and what is the examiner thinking when asking those questions, you could also get a gist of that from giving the previous papers.
Right. Infectious disease, question on IMN clinical features, leptospirosis nephropathy. Anuj, if you remember or recall this question, this was hand-picked from Harrison. Okay, question on leptospirosis nephropathy, hand-picked, same exact line from Harrison. So sometimes you can get such questions as well. So somebody who has read Harrison only will be able to, they ask which electrolyte abnormality is associated. So that is there in Harrison only. So you have got to pick it from Harrison. CMV, ganciclovir resistance treatment, amoxicillin clavulanate, raised ALP, Plasmodium falciparum malaria, treatment in pregnancy, larva occurrence, TB pleural effusion, Banworth syndrome, leptospirosis, false statement, curve 65, PCP pneumonia, indication for steroids, varicella. See, what I want to tell you is do not get a question wrong from curve 65, which is something a NEET PG aspirant also would get it right. So Even if you get it wrong from leptospirosis nephropathy, okay, some candidates will get it right. So again, you can see many commonly asked topics. Anuj?
The majority of the topics we would have read in NEET PG as well in microbiology section.
Yeah.
Also, this as a section in general is ignored in residency and during MD preparation, because we don't get many questions from the infectious diseases except the major diseases like TB, syphilis, and HIV. So we tend to neglect the other part of the Harrison, and it occupies a very big chunk of the textbook. So at least go through the major diseases like the major the protozoans, the major bacteria, gram-positive bacteria, major gram-negative bacteria. So you should at least go through them once. So you get at least the clinical portion, the presentation and the treatment. You can get those questions right.
So I think the HIV part is also expected topic area. Maybe next time you might get good number of questions. Usually they do ask 2 or 3 questions from HIV, and if you go through the DocTutorials videos, Dr. Nia sir has who has done DM infectious disease from AIIMS Delhi. So sir has beautifully covered the infectious disease topic, and are too in a simplified manner, shorter videos. You can easily cover them. So please go through the infectious disease videos as well. So overall, Anuj, I agree with you totally when you say that focus mainly on the high yield areas, high yield topics, and I think going through them and revising is more important rather than you might not get time, right? Did you get time to, or when you used to revise, how was your revision? Did you go through the entire content again, or how was it?
No, actually, I had started preparing in the last, like the same time frame I had, 2.5 months. So I used to maintain a small notebook which I used to just write down the high yield points, and the points I would forget. Like if I would solve the MCQs and I would got them wrong, I would write them down so that next time I would just read those and try to skip by those areas which I think are good and have scored very well in the modules or the GTs. So that was one of the main things. And the last 3-4 days, I just went through the tables, majority of the tables and flowcharts of the Harrison, so that if any questions which come from there, they're actually very volatile. It might seem not so, but the tables and flowcharts from Harrison's are very volatile, and definitely questions are asked through them. So just keep last 2 or 3 days for them so that you can go through them quickly.
Okay, right. So any queries you have, please type in the chat box, okay, regarding the preparation. And so finally, what I want to tell you is, this is my summary for the session. I think since you have got 3 months, the preparation strategy varies from candidate to candidate. I think it's very important to plan and prioritize your resources depending on your current preparation level. There are multiple resources. Yes, you have got video lectures. Whatever app you are following, you will have video lectures. If it is for the DocTutorials that you're following, you will have the main section of videos, the QRP videos, the test and discussion videos, PYQ videos, and now you have got the Harrison videos, Harrison tables and flowcharts videos. Now, again, you have got to prioritize even within this. Suppose you say, sir, I do not have time to watch all this. Please at least watch the QRP and the Harrison tables and flowcharts. Still, if you have more time, the test and discussion videos as well. Okay. But if you have already watched main video lectures, fine, good, please revise them. You have got Qbank, Elite test series, the grand test are there, Harrison textbook, super specialty textbook. And remember, as Dr. Anuj rightly pointed out, if you have already gone for, say, INI gastro preparation, you are done with Schlesinger, then okay, please revise whatever you have learned. But this is not the ideal time to start venturing or exploring a super specialty textbook. So it's about how you plan and prioritize. Now, many candidates have messaged me, Dr. Anuj, whether you can take should they work and then prepare, or should they take a leave? So my personal suggestion is, if you are in a position where you can spend time, then please spend time with studies maximum. That is what I would suggest. And I always tell candidates, you spend a minimum of 8 hours per day. Okay, 8 hours per day. Because yes, because sometimes, certain seniors might mislead you, telling that there are so many super specialty seats. and some of them even go vacant. It's true, but see, what is your aim? You have got to get into a quality institute. You see, Dr. Anuj is now doing DM endocrinology from the prestigious KEM. So it's important to do your super specialty from a reputed institute, which is having good exposure, and it provides you good training. So I would say 8 hours per day, you should put into studies. And I would prefer that you not work if you have that provision. But otherwise also, there are many candidates whom I know, they have been working during these last few months, maybe last 1 or 2 months, they have taken the leave and then studied. But when you study, let me tell you, when you were a NEET PG candidate, I think, you would easily keep the mobile phone by the side and then learn. But at this age, with so many responsibilities, studying for such long hours may not be easy. And so that's what I want to tell you. But still, you have to prioritize and put in that time. Anuj, just out of curiosity, let me ask you, were you working in that 2-3 months that you had?
No, sir. I had just passed my MD exam, and then the NEET SS closure came out. Then I devoted the entire time to preparing.
So that is the best idea, Anuj. I think, anyway, you're preparing for such an important exam. So give yourself the best chance. That is what I want to tell you. Okay. So all of you just keep preparing well, and any queries related to the videos and all of DocTutorials or the new Harrison videos and all, you can message or call in these numbers. And all the best for your exam. And I think, Anuj, having you was an absolute pleasure, because you're someone who has done exceedingly well in the recent NEET SS exam. And hearing this from you, it gives the candidates a good idea. Okay, because see, if they ask me last 3 months, should we entirely devote to preparation? I can tell that, see, this is what Dr. Anuj has done, and also majority have done. Yes, there are a few candidates who have worked along with this and got as well. But the probability that you crack with a good rank is more when you spend more time with the books without distractions. And Anuj, just one more trick from your side. How did you maintain that focus during the last 3 months? Were you so dedicated, or it was, you are someone who's adjusted to a very noisy environment?
I was not that dedicated, sir. I would not be sitting for long periods of time just studying. I would go around, see TV and all. There were Commonwealth Games at the time, so it's not that I was just studying. I would definitely take some time off during the weekend or something. Right. So basically, it depends on how you want to study it. It's all personal. It is what works for you, how you retain well, whether it is by reading a book, by seeing a video, by seeing a PPT, or reading your own notes, or solving MCQs side by side. Anything. You have to find out what works for you and stick to that till the end, and see what works best for you and what you retain best after doing anything that you do best is the thing you should stick to. Not just blindly follow anyone and blindly follow whatever anyone says. Just not like, if you should not just look at me and just go like what he has done, I should also do.
Very important, because I think, preparation style varies. Something that, works for me may not work for another candidate. So I think it's important to listen to everyone and come out with your strategy. What am I going to do in the remaining 3 months? How am I going to study? What is going to be my timetable? How much effort I've got to put in with my current knowledge? So I think you've got to analyze this before, you proceed ahead. So I think very valuable advices, Dr. Anuj. Thanks a lot for taking out your time, and hope to see you also soon. Okay.
Thank you. Thank you for having me.